Healthworks, the COVID numbers are not going in the right direction. Right now, it's not a crisis, but it is frustrating and discouraging as COVID is continuing to cause problems. A simple check-in with friends or family, and you might not even need the data to tell you what's happening with COVID. Tuesday numbers show a 30% increase in Michigan COVID cases from the previous week. It's something Beaumont emergency doctor Jamie Hope is seeing firsthand.
So we are seeing an increase in cases again. So we're seeing more people testing positive when they're coming into the emergency department. And so the numbers are on the rise. So I know it's frustrating and we're tired of it, but we have to maintain our diligence as new strains change and it continues to evolve.
This BA.5 subvariant is new, but the COVID symptoms remain the same.
You get the respiratory components that we're aware of, and people can also get the gastrointestinal symptoms, the nausea and vomiting. But sometimes having the COVID can cause things in a vulnerable population, such as increase the risk for a heart attack. So we are seeing, as people get it, those who are already sick are getting sicker with other medical conditions as well. So we're seeing that. So if people are experiencing symptoms of shortness of breath, chest pain, or anything like that, they should proceed directly to an emergency department for evaluation.
One Fox 2 viewer wanted to know, what do you do if your spouse is COVID positive, but you are in fact fine and COVID negative?
If you are negative, you still want to continue to isolate from people who are positive, just as a protection to help prevent the spread. So that includes your masking, avoiding touching your face, hand washing for 20 seconds, and maintaining that physical distance.
Dr. Hope does admit the guidelines are a little bit confusing when it comes to how to handle a suspected COVID case. So this is from the CDC. If you think you have COVID, you're getting tested, you're isolating at home for 5 days, and if you're living with someone in your household, you're also wearing a mask to protect that person. That's Healthworks. I'm Dina Santafanti.